Okay. Well, when we came in the first time, we came in for a seminar for the neuropathy. Jayesh had a different type of neuropathy. He went through, he had colon cancer type 3. That's what they say. He went through chemo, radiation, and from the chemo, he had the side effects of the neuropathy. And that's where I read about the seminar, and we came in, and we got him going with the light therapy and everything. And he was low on his vitamin D, and Dr. Legree took care of him, and now he feels like he has 3 times or 4 times or 5 times more energy than what he had. His skin is getting way better. He had little eczema patches too also, but everything is getting better.
Tickling almost gone, maybe 20% left.
Wow.
The leg.
And then he can feel his shoes.
I can wear the shoes now.
He was snapping sometimes when he even had to.
My mind now, I can work, when I do in 20s.
Yes.
Let's fix this, let work,
You feel like you're in your 20s now?
Yeah. Because now my days, remember I can work now, I can fix maintenance, I can do
Oh,
anything.
yes.
And his nerves are all opening up.
Yep.
He used to drop stuff when he used to pick it up, but now
I cannot
it's just
feel when I pick up something, now I can do that.
That's wonderful. Jayesh, how old are you?
48.
Okay. Yes.
But I can work, I cannot feel like I'm 48. I'm a young guy.
Another amazing thing, I know y'all can't see me, I'm here behind the camera, but another amazing thing that happened with Jayesh is he had a lot of scars from the surgeries with the colon cancer, and during this treatment process here, the scars started fading. It's like they're hard to even see anymore. His skin was responding to this treatment here too and totally healing itself, and it's just been amazing to watch.
And also, during his treatment, after his ostomy bag was replaced, his whole system is very normal compared to what the doctors used to say, that you never know what kind of normal it's going to be, but it just, he feel like a regular normal person.
Bowel movement wise.
Yeah, bowel movement wise. So, because after the surgery, the doctors say that you never know what that bowel movement normal is going to be. It's going to be diarrhea, or it's going to be something where, he's going to be constantly going to the restroom, but it's just like a normal bowel movement, like a normal person would have.
That's so important. That's one of the biggest points, because...
Sorry.
Yep. Nope, that's fine. The damage and the toxicity to the small and large intestines can permanently leave a person, and the MDs see it all the time, what you're saying. So we added in some intestinal healing and repair, and that's what we wanted to rebuild, Jayesh. So we did some immune system help, and that's what true healing is coming in. That's where the energy of a really younger person comes in. And so I'm so happy. We made sure that we covered that and picked up the ball, because I knew there would be damage from the colon cancer.
Also, he was taking metformin, cholesterol medicine, high pressure medicine, all of those.
No more
medicines. Even gabapentin that they were prescribed, he stopped taking that. So he's off. He has no medicine,
but
only supplement.
We have to follow the treatment. What you say, If you told me, hey, do that, but if I don't do that, it's not gonna work, It's the main thing.
All on us.
follow the therapy. That's it.
Yes, and because you were, at cause and ready to take responsibility, we have the technology, but the technology is no good unless that diligence and the effort strategy and 100% responsibility for your health comes in. That's the only reason our technology works amazing. Yep, that's the most important point for these guys to hear. Because if you get lazy and you think a pill is going to fix you, what the pills of neuropathy will do, gabapentin, Neurontin, Lyrica, they will cover up the problem. Meanwhile, the problem grows to a bigger and bigger iceberg until it takes down your Titanic and you are falling. You're on a walker. You lose your license because you can't feel your brake pedals and your foot pedals. The choice is yours. It's never in our court. It's always in the patient's court. And then we show you how you can heal yourself.
And Jayesh, you've done that. Wow.
Yeah, you've been a model example. This
is only like the side effects of our chemo and radiation. So, we're just trying to make ourselves normal again, where we want to be back to ourselves and not fight all this again and do all this. And so this is, even after everything is done, if we didn't want to do it, we could have. But, we wanted to make sure we want to go to the right path, and we don't want to go back to this whole, prescription thing and no medicine stuff. So we want to be back to our normal selves.
Yes, the most important.
And the prescriptions is never going to take us to our normal selves.
So there was how many medications? Now that we've established more normal function and physiology, there's no more metformin.
No more metformin. No more cholesterol medicine. Low sodium.
No more sugar.
No more
Pills now, right?
No sugar. Metformin. That's metformin.
Yep.
High pressure medication. No more high pressure. Cholesterol. No more. Gabapentin. No more.
Right. No more statins.
No more statins.
Yep.
Nope.
This is awesome. Like it's such a privilege for us to be able to use our technology and have it actually work, because you guys are 100% ready to change.
Food allergy test help us out too on what kind of foods to eat, and that kind of maintained a lot of stuff that we didn't know, about the sesame seeds, because he would eat sesame seeds every day, thinking that, but that, that was one of the food allergies, so we stopped that. We stopped a lot of those. Sugar, we stopped that.
Yeah.
No sugar. The stevia works really good.
Yeah, this is amazing. Right, we're about at the 8-minute mark, so it's please pass this video on and share and like it and spread it to your friends, because there is no answers from the conventional approach of covering up the symptomatic pain with gabapentin, Neurontin, and Lyrica. It's a dead-end street. Neuropathy is progressive. It will definitely take your independence, 100%. It doesn't care. You either learn by trying an alternative, or you learn the very hard demise of complete loss of independence, because neuropathy does not care what your limited knowledge and understanding is about the situation. You have to seek out an expert. And that's the most important thing, is that choice. With knowledge, people perish. With the right knowledge, people thrive. And this is an example of people thriving. So the ball's in your court. Thank you so much, Rishika and Jayesh, for being amazing, disciplined patients. Yes. We love you guys. Definitely.